today we are going to talk about gut parasites. We're talking about Coccidia, generally known as the cocci. These are gut parasites. They lay their eggs are called oocysts or oocysts, and they live in the pasture. And the alpaca grazes the pasture and picks them up. Now, alpacas are very good at having areas where they poo and areas where they graze. But when you graze them too tightly, so you have higher stocking levels or not enough grass, then they start to graze where they've pooed. And that's where you start to get your gut parasite problems. Now, we are going to talk about some specific ones today. We're going to talk about the big cocci and the little cocci. So the little coccies, if I had an animal that looked unwell, ran a fecal check and found a high count of little coccies, then I would consider treating. But the one we really worry about is the big cocci. And I could give you its technical name, but it's generally known as EMAC or Big Mac. Now, the coccies are alpaca specific. There's a lovely cocktail. They're alpaca specific or camelid specific, so they don't share them with sheep and goats. And EMAC can be really harmful to an alpaca. It can do a lot of damage before you start seeing them shedding eggs, or cysts. So we need to keep a very close eye on them in the cria, particularly risky to cria. So this year, the first year we found at 2 separate fecal tests, we were running fecal tests every 6 weeks on every alpaca individually here, we found a couple with a single EMAC egg on 2 consecutive tests, different alpacas, because obviously we treated them when we found it, and retested 2 weeks later to make sure that they were clear. But having found that we were getting EMAC eggs into the samples, we decided to treat all the cria. Now, at this point, they weren't weaned, so we didn't treat the mums. We don't want to build up resistance to the treatment, but we treated all the cria. We haven't found any EMAC eggs since, so that's good news. So there we are, one healthy bunch of cria.